Okay, well, let me say to the patients that are here, with COVID-19 raging and your health care being our priority, certainly is my priority as a member of the United States Congress representing this area, and I've done a lot to try to keep the Heights Hospital open over the years. Let's say that it's been challenging over the years. We've had a number of, how should I say, partners, which you may know. One, as they say, has departed. I still think it can be a functioning hospital with all the needs that we have. Just have to find a committed partner to work with doctors who believe in working in the community, working with patients who live in and around this community. So, without me doing anything more, I have to try to reach these individuals that are no longer functioning. And I'm going to call the sheriff and see if he has any ability to, whether there's been any kind of way that he can open the building for allowing doctors to get their belongings. They don't belong to this bankrupt situation at all. They belong to the physicians here, and to Dr. Thomas and Dr. Mack. Let me first of all thank you, all of your health professionals that are here, your nurses and medical practitioners. Let me thank you. I see a lot of folk here, to the patients. Let me apologize that you will be treated in this manner. That's why I don't have on a business suit, because I came running because I'm on the way back to the nation's capital so that we can get the kind of leadership that I can get response to. But we're going to immediately try to reach Texas Health Department and try to find out what's going on. That's what we're going to do in the immediacy. Okay? Thank you, Congresswoman. Thank you. I think this is a shame. I've never seen this before, that sick people are locked out and doctored.
These are the best doctors out there. My whole time. Almost 2 years now. This is the best care out there.
¿Tienes alguna pregunta?
Staff, everyone. I've never been here. Everybody's like family here.
And what's your name, sir?
Milo.
Milo, this is the best care that you've ever got.
Ever.
So there's really no reason to lock them out for any deficiency. They're at their best.
Yes, ma'am.
And it's so interesting that when we're in the midst of a pandemic, when doctors and health professionals have sacrificed their lives to treat patients of all kinds, that we would think that someone would do such a dastardly deed. They should be called out, whoever they are, in terms of doing this kind of action. This is a insane action that doesn't allow patients to be cared for by physicians. So this is a combination of the state health department that we have to reach out to first, and then the federal health department, and maybe law enforcement to try to get to the bottom of this. Tragically, you may not be able to get in today, but I am going to work on to see what we can do, and I will continue to report back to the two doctors. I want to make sure we get your name and number. So I'm going to start working on it right now.
I'm trying to secure another location as we speak to see patients tomorrow.
All right.
Congressman,
And because they're not suggesting that this is, it's a shame this is on the day of Martin Luther King's celebration. A man, a dreamer, and a man who cared about people. Yes.
We've been asking even the mayor. I mean, there's a moratorium on the. Let's say, for example, there was some problem with the building agreement or what have you. There's a moratorium on evictions for the very reason that we are in the midst of a pandemic. What does this say to you that this is happening at a hospital?
Well, it says that this is a heartless action, and that bankruptcy should not be superior to patient care. Bankruptcy indicates that bills cannot be paid. I practice bankruptcy as a lawyer, and I help write the bankruptcy law for the federal government. And one of the things that I was concerned about is the inequity and the unfairness on the persons who suffered because of bankruptcy. That an entity went bankrupt, and then the persons who were the sufferers were the innocent persons who needed the services. In this instance, they should not be suffering because they need the services. These physicians should not be suffering because they're here rendering the services. So bankruptcy is cruel, but it is not in any way, I think, responsible or their right to shut out patients and doctors from doing their work. So I don't think the state health department is aware of this. I need to determine that, and I certainly, we need to determine that if they are receiving federal funds because of Medicare and Medicaid, that we look at what is occurring with that. And how can you have part of the hospital open treating patients and these outpatients can't be treated? Does that seem a little ironic? I think it is.